my name is Dr. Stanley Lang, and welcome to this video. This video is for a busy, stressed woman with brain fog. So if that's something that you're experiencing, then the information I have to share with you should be very helpful to you. Now, brain fog is something that is actually pretty complicated. It is something we treat effectively, but it has a lot of different causes, so there's no way to give you a way to fix your brain fog in a simple video like this. However, there is a major cause of brain fog that magnifies brain fog that we can do something about even today on this simple video. So brain fog is a symptom that many people experience, although it's a little bit hard to describe because it isn't actually a clinical diagnosis in most situations, but it's something that feels a lot like I can still think, but it's so much harder to think, and it's harder to get through the process that I need to get through. It's kind of like walking through 6 inches of mud. You can get through it, but it's a lot harder, a lot slower, and so the thinking process is just slowed down a lot and just requires a lot more effort. So the person with brain fog is usually somebody that has a lot of responsibilities and can't take the time off to stop everything just because the symptom is there. So when this brain fog continues day after day, week after week, month after month, it doesn't usually just stay the same. It usually is getting worse. And once it starts to get worse, that starts to trigger some anxiety about what is causing this in the first place. And the anxiety itself then becomes something that magnifies the brain fog. And so what we're going to focus on today is a solution for this loop that anxiety feeds into brain fog. The brain fog continues and then magnifies the anxiety, which then feeds into and magnifies the brain fog. We're going to do something today that interrupts that loop and decreases the symptoms a lot and fairly quickly. But before we do that, I just want to review some of the major causes of brain fog, just to sort of set the table of things that you might want to consider as things that could be going on in your life. The first and most common cause is actually bad food. So food that has the wrong chemicals in it, the wrong nutrients or missing nutrients can actually lead to or worsen brain fog. Second thing I want to mention is chemicals in general. So there's lots of different chemicals in the environment, and some of them are added to the food supply that can magnify or cause brain fog. The third thing I want to mention is bad sleep. So bad sleep or disrupted sleep, or we would say that it's not restorative sleep. This will markedly magnify brain fog. Now, bad sleep has lots of other causes by itself, so that's only a symptom to kind of pursue and figure out what are the causes of my bad sleep. The fourth thing I want to mention is a growing major cause of brain fog, which is EMF, which stands for electromagnetic field or electromagnetic frequency. And so we're bombarded with and surrounded by EMF, and it's increasing, and for some people it's a major cause or at least magnifier of brain fog. And the last thing I want to mention, at least in this short list, is chronic Lyme disease. Now, we treat a lot of patients with chronic Lyme disease, so over the years I've seen a lot of patients have significant brain disruption from their chronic Lyme disease, everything from bad memory changes, loss of memory, to brain fog or anxiety. So these are many and diverse different things that could be causing your brain fog, but once you have it, as I mentioned, this starts to trigger anxiety because of the symptom itself. There's an awareness that something's wrong, and usually not an awareness of why it's wrong, and so the symptom of anxiety is a natural response. So anxiety is another way of saying I'm afraid. So people who are having anxiety, sometimes they can't put their finger on what they're afraid is happening or they're afraid might happen, but a lot of times they're sort of aware of these things. They're afraid that something bad is happening, or they're afraid that something bad is going to happen because they're not functioning as well as they want to. For a woman who has a lot of different responsibilities, which might include children, relationship with a spouse, work responsibilities, other family responsibilities, perhaps an aging relative, friendship responsibilities, and maybe other things that you are taking on into your life as a responsibility. All of these things make the brain fog and anxiety even worse. And so it's hard to get out of that situation as a woman once you're in it, because for most women, once they have accepted a responsibility as being important enough for them to take responsibility for it, it's very difficult for them to just let go of it, and it's very difficult for them to just drop it. So women tend to hold on to the responsibilities for which they've taken serious responsibility, and to try to continue to manage them even as symptoms like brain fog are worsening or anxiety might be worsening. So the strategy that I want to talk about today that will help you with this symptom and can help you many times during the day is a breath work strategy that you may have heard of, but if you have heard of it, you might have heard it explained in a way that isn't best for you. So this breath strategy is called the physiologic sigh. So the physiologic sigh is being taught by a lot of people as a way to decrease your anxiety, and a lot of people that teach it in a way that does help, but for some people I've seen they're teaching it in a way that could actually make things worse, and I'll explain why that is in just a moment. But the physiologic sigh is something that is sort of misnamed, actually, because what we actually have as a physiologic sigh is different from what is actually taught as the breathing technique. So the physiologic sigh exists so that your lungs expand every once in a while to fully expand, so that the small little alveoli don't collapse on each other, because most of the time when we're just sitting around, we have a lot more lung capacity than we need. So what the lungs does is that it senses every once in a while the need to take a full breath. This is done subconsciously. So this physiologic sigh happens about once every 5 minutes or so, about 12 times an hour, more or less. And sometimes a little bit more often, but doesn't happen very often. So it's happening at a level where we're not really aware of it most of the time. Now, we become aware of it once we become a little bit nervous, and so you might notice that you take deeper breaths more frequently when you're more nervous, and that's basically the physiologic sigh being expressed in a way that's not in your best interest, because once you start taking that deeper breath more frequently, your carbon dioxide levels drop pretty rapidly, and when they drop low enough, you're going to start to feel a lot more nervous. So what happens is that a lot of people, when they become stressed out or they feel nervous, is the control of this physiologic sigh is kind of overridden. That control system is in the lower part of the brain, and when we become more nervous, the conscious part of the brain sort of takes over and starts overriding that breathing system that causes us then to take a lot more deep breaths than normal. So when we take these deeper breaths more frequently, we're basically taking that physiologic sigh, only we're doing it in a way that's not doing us any good, because when we start taking that deep breath too frequently, the carbon dioxide levels drop rapidly, and that makes us feel even more nervous. So the trick is using the physiologic sigh in a way that actually triggers relaxation and causes us to be much more peaceful. So basically there's sort of two different physiologic sighs. One is where your body is taking a sigh every once in a while to keep your lungs healthy. The physiologic sigh being taught by different practitioners to help people have less anxiety is kind of a modification of what is actually our physiology. And the way the taught version of the physiologic sigh is to take a deep breath and then to take a second breath on top of that, and then to exhale slowly over a period of a few seconds. Now, when you watch somebody breathing and you notice that they take a deep breath every once in a while, you're watching the physiologic sigh. And what you'll notice is they don't take a second breath on top of their first breath. Now, if you analyze people in a very fancy laboratory, you'll see a little blip of a second breath, and that happens after they take the deep breath, and that's where that comes from. But what's being taught to people is not that physiologic sigh. They're taught something quite different, which is to take a much more noticeable second breath, which has some advantages and some disadvantages that I'll mention in a moment, but that's then followed by a slow exhalation. When you take this deep breath followed by the very slow exhalation, that triggers what is called the parasympathetic system. There are many other ways to trigger the parasympathetic system, but this is a very fast and simple way to do it. But I'm going to teach you a variation of this that will work a lot better than what is usually being taught, and will help to protect you from accidentally pushing yourself into hyperventilation. The reason it's important to not let yourself be pushed into hyperventilation is that that's going to cause you to feel more anxious. So doing the physiologic sigh wrong will actually make you more anxious in the long run. So I'll be teaching you a variation of the physiologic sigh that is, I think, better for most people when they need it. Because if you do the physiologic sigh, as you might see on some videos, it looks pretty noticeably obvious that something's wrong. And most people that are in the middle of an anxiety symptom, they don't want to be broadcasting to other people that something's wrong. So I'm going to teach you how to do the physiologic sigh in a way that doesn't broadcast that you're having issues. In other words, you can apply this strategy without making other people ask, well, what's wrong with you? This is a simple strategy when done correctly, and it leads into another method that we teach that can be done long-term all through the day that helps to control anxiety very well with just your breath. So I'm going to teach you a way that's much more practical than is being taught most of the time, because I'm going to teach you how to do it in a room that's full of people and they won't notice that you're doing it, which is a useful tool to have. And I'll then teach you how to transition into a broader strategy that will be something you can do all day long that will help to decrease your anxiety. So if you want to learn the technique and so to speak, breathe along with me as I'm doing it, please follow me into that next video. I wish you well, God bless, and have a great day.